So today we are going to discuss in detail about diabetes type 3 and how is it linked to Alzheimer's disease. So what exactly is diabetes type 3? So it's basically an insulin resistance and deficiency of insulin which is created in the brain, and it particularly affects the brain resulting in Alzheimer's disease. So the signs and diagnostics of these two diseases are similar, and it is related to Alzheimer's disease. So further in this presentation, we'll discuss about causes, nutrition counseling provided, treatments, and also there's a quiz towards the end of this presentation. So could Alzheimer's disease be diabetes type 3? All have heard about type 1 and type 2 diabetes, but this is a new research that shows the link of diabetes eventually resulting in Alzheimer's disease or dementia or other types of cognitive impairments. So according to studies, this is the insulin resistance which is affecting the brain. As we all know that insulin is an important hormone in carbohydrate metabolism and in the brain, and due to this insulin resistance, there's energy deficits and other neural dysfunctions caused in the brain. Also, there is amyloid beta proteins, which is a particular diagnostic of Alzheimer's disease. So there's an accumulation of these beta proteins in the brain if a person has Alzheimer's disease, which also happens due to diabetes, which shows a clear link between these two. So there are also studies which state that people those who have diabetes type 2 can eventually have Alzheimer's disease. Their chances are 60% more than people who do not have diabetes. So summarizing this research, data suggests that there is connection between these two, and diabetes may affect the brain eventually and lead to cognitive impairments. But to understand the entire thing and provide particular specific treatments for this condition, we need more research and evidence in the same area. So let's have a look on two case studies of people who had diabetes and who developed Alzheimer's disease eventually. So this is a case study on a 58-year-old man who had diabetes type 2. He was given the medications for the same, and he did not manage them well, and eventually he showed signs of cognitive decline. He had memory loss, short-term memory loss. He had problems with communication and language. So there were brain atrophies taken for this person, and it showed amyloid plaques, which is the beta protein which shows the evidence of Alzheimer's disease. So the patient was put on insulin treatment, and later on his cognitive problems were improved. Another case study is of a 76-year-old lady who also had diabetes type 2, and she also had a history of poorly managed diabetes levels, and eventually she also showed signs of memory loss, speech problems, and language issues. And when her brain atrophy was removed, the similar thing, that is amyloid plaques, were found, and brain shrinkage was noticed, and due to this she eventually had mild dementia, and the patient's cognitive symptoms also improved when she was put on insulin therapy and insulin treatment. So these are the references for the research and case study that I presented right now.